Good afternoon, everyone. So we will be starting with our today's topic, that is vaping current threat. So vaping in simple terms is e-cigarette or electronic cigarette. So it is akin to cigarette smoking. Uh, Smoking is legal, right? So smoking in adults can be used, but so what we need to first of all, right. So smoking is legal, but vaping is not. So vaping is legal in some countries like UK and USA. But as far as India is concerned, it is illegal. So there is an act of 2019 which uh, prohibits the production, distribution, and use of vaping, with the first time offense carrying 1 year in prison or 1 lakh rupees. So, and then it goes on increasing. Even storing it or carrying it is a punishable offense. So it is something like firecracker ban that we have in Delhi. Like everyone is using it and still it is banned. So probably not the right way to go about it. Let us dwell on this topic and see how is it in relation to smoking. Is it worse, better, same? So to discuss this topic more, we will talk to our specialist. I'll ask Dr. Ankit. So what are exactly these electronic cigarettes or vapes, and how do they work?
Right. So basically, vape is the name is used interchangeably with the electronic cigarettes, and it is something which simulates a tobacco smoking, right? And if anyone is using an e-cigarette or a vape, it is termed as vaping. Now, these vapes have a lot of modifications. So, the first generation vapes, we can go on to the next slide, sir. Yeah, so this is how a vape looks like, right? So basically, the vape contains an e-liquid. That's the most important part, which you see here. And this is the cartridge which contains the e-liquid. This e-liquid contains a lot of things which we'll talk about. Now, there's an atomizer which, when heated, would convert the liquid uh, inside the cartridge to form an aerosol, which actually the person would inhale. Now, how this heating happens is basically by the battery which is there inside the e-cigarette. And this battery can either be activated manually in some versions, but in most versions, there is a sensor which senses when the person inhales, that automatically would draw in current, and that actually heats the atomizer and converts this liquid into a vapor. Uh, Now there are a lot of modifications which have come up, which I'll just show you. So again, this is an e-cigarette, which is again shown here. So it has a lithium ion battery, which can be, in some versions, it can be recharged, in some it cannot be recharged. There's a cartridge. In some models, it is replaceable. In some of them, it is not. There's an atomizer and a heating coil. Yeah. So these are first generation e-cigarettes, which so vaping actually started with these, and they are basically single use. You cannot refill them, you cannot recharge them, and they exactly mimic a cigarette, right? So these were the first generation vapes. Now these are the next generation vapes, which are rechargeable. So you can recharge the battery which is there, and it is basically designed to be used multiple times. The e-liquid is either pre-filled. In some versions, it can be, you can change the cartridge, and hence it can be used again and again. The cartridge is attached to a pen which is there, which actually contains the battery. Now, these are further advanced version which are there, and these are the third versions which are there, and this is what they look like. So they could be in the form of either sub-home tanks, or they can be in the form of mods, right? Now, these tanks basically contains low resistance coils, and it is designed to create a large cloud or an aerosol, which has a stronger delivery or hit of nicotine or other substances, right? So if person wants a larger dose of nicotine or the vapor, then people like to use them. These are mods. So mods basically stands for modifiable devices, and they basically allows the user to customize the substances in the device, and that is what is actually leading to a lot of havoc amongst vape users, because a lot of them are actually adding illegal substances to the vaping liquids, as we talk about. And these are the fourth generation, which are called as pod mods. And basically, they have pre-filled or refillable pods or pod cartridge. So what they do is that they use a modified version of nicotine known as a protonated nicotine rather than a free-based one. And that actually provides a higher yield, right? And so it is a less irritant to the throat, but the amount of nicotine which actually goes inside the body is quite high. Now, there are other things like e-hookahs or vaporizers, which are there, which are extensively used. So it is an inhalational device to release active substances, which might be organic or inorganic in the form of an aerosol through application of a non-combustion heat. And they can, aerosolize things like dry herbs, wax, and oils. So, for example, people use it for cannabis or THC.
So, what is the current scenario of vaping in adolescents and adults? I'll ask Satinder ma'am to please highlight. Unmute. Dr. Satinder, you have to unmute. Right.
Sorry, I'm sorry about that. As we can look at the graph, that how the vaping from 2012 to the current trends, it is increasing only. You can see the amount in the global estimation from 21.3 million to going up to 86.1 millions worldwide. Next slide. So basically, the research is showing that vaping is very prevalent, unlike although it is illegal, and most of us don't even know that is illegal. It is something which is most adolescents, even in schools, children are having e-cigarettes. 4% of adolescents between the age of 15 and 24, they report that they are aware of e-cigarettes and they have used it as per the research. It is very attractive to young students because because there are a lot of myths regarding the vaping. It is considered very safe and it is harmless, which it is not, as we'll progress in the talk today. It is very attractive to them because it comes in different brands and there are a lot of flavors which attract, and it is easy to use it. And because they are looking at the tricks and they are looking at in the social media that how they can use the smoke and you can do the tricks, they are very fond of doing it. The youth get promoted because of the flavor, which is easy to use and it is not as bad in taste. So they get more attracted towards this. As reported in India only, there are 75 companies which are selling e-cigarettes online. And in order to protect, because it was so prevalent and it is so easy to get addicted to, so the Indian government had actually banned it. But having said that, it hasn't been banned. You can talk to any school students. The research from the lower socioeconomic or from the higher socioeconomic, all socioeconomic groups are using e-cigarettes. The first-hand experience from the students, they say that they can go to any pawn shop, they can go to any shops where e-hookahs or the hookahs are being sold, and they will just name e-cigarettes or things like that, and they will be easily have access to this. I am also aware that many schools first-handedly pick vapes from children's bags because they look like pens, so it is very difficult. And many schools go on rampant searching the school bags just to pick out because and they found vape very easily in students' bags.
Right. So it is a current threat, and you have already answered my question of why vaping is promoted in adolescents. So I'm just you can just reiterate if you
So
want.
same thing. It is
Yes.
basically that some people, and I think the initiation of vaping started to reduce the use of cigarettes. But unlike research, it is showing that the cigarette usage, people get addicted to vaping also, and they're using both the components at the same time. It was assumed that vaping is going to be harmless, but it is not. Because it is cheaper than tobacco, and because smoking tobacco is not allowed, and vaping is, unfortunately, people don't know it is also illegal. You find your friends, siblings, social media being emphasizing. So all those factors, looking cool, copying, and many times if adults are also using cigarettes and vaping, children tend to model it and copy the same behavior.
Right. So you've already answered this briefly, why it is better alternative to conventional smoking. Anything to add on, ma'am? Simply because of flavor.
It is less harmful, but it is not harmless, is I think that is the word we need to say. So it is not an alternative to conventional smoking, although it has come in the market because of that, but there is a lot of addiction to vaping as well, and that we'll discuss in the coming slides, I guess.
Right. So this is just confirming those factors that we have discussed. Now, Dr. Ankit, what exactly does this e-liquid contains? What is there in this vape and e-cigarettes?
Yeah, so the e-liquid inside the vapes basically is a combination of humectants, which actually convert the or produces the aerosol, which actually simulates the cigarette smoke. And the main content is propylene glycol and glycerine, and that constitutes approximately 95% of the liquid. Now, the important part is the 5%, which could be flavoring agents, right? They could be natural, artificial, or organic. But there are a lot of chemicals which are found inside the e-liquids, and there are approximately 80 odd things which have been found, which includes things like formaldehyde. There are things like metallic nanoparticles which are found. So approximately 15,000 flavors are something which are thought to be available in e-vapes. Now, the major part of the problem is not just what is legally there in vapes or e-cigarette. A lot of them, as we had shown, they can be tampered or they can be modified. And a lot of people actually use it for using things like cannabis, which the active product being the THC, as we call tetrahydrocannabinol. And that is actually a psychoactive substance. A lot of people actually would modify or the e-liquid inside the vapes. And that is leading to much more problem as compared to conventional vaping.
So that is exactly why probably this has been banned, because it is almost impossible to monitor what is there in vape. So that is one of the reasons why government probably feels putting a blanket ban may not be an option, may not be the correct way to go forward, but because they are not able to monitor, that is why.
Yeah, so that is what is known as hacking. So hacking is basically, doing post-marketing or the post-market modification that is, beyond the intended use by the manufacturer. So people try and hack the closed system, such as the pod or the cartridge, and it becomes really different. There's something known as dripping as well, which has been described, where the user wants to, want a bigger fume or the aerosol and they try and increasingly heat the e-liquid inside the vapes. And it is dangerous because a lot of amount of THC can go inside. Now, these e-liquids contain things like nicotine. They also contain volatile organic compounds. They contain ultrafine particles. They also contain heavy metals such as nickel, tin, lead, and cancer-containing chemicals. And it also contains sometimes, and there was a lot of talk about this, a vitamin E form known as diacetyl, which was there, and that led to a lot of lung injury. The problem is that if you look at the content of e-vapes, it might, or the vapes or the e-cigarette, it might appears to be, quite simple and may not be that toxic. But when it actually when it is actually heated and converted into the aerosol, the what the aerosol contains is important to understand, because after heating, the content can get changed. The heating coils can actually emit heavy metals such as nickel, tin, and lead. So what is postulated to be there and what actually goes in can be different.
Right. So
yeah, so that is what we have talked about. So the e-liquid contains things like the humectants, as I talked about, propylene glycol and glycerine. It also contains nicotine and flavoring agents. But as I said, it can be hacked, where it contains things like cannabis or ganja. And then you have the device material which is there. So the wires, the atomizer, the fiberglass wicks, and the solder joints. And when this actually gets heated, you get myrate products. So you definitely get propylene glycol, glycerol, and nicotine in the aerosol, flavoring agents, others. But you also get these things which are listed here. So metal particles, silicate particles, propylene oxide, aldehyde, formaldehyde, and acetamide. So these are the particles which actually lead to a lot of damage inside the lungs.
right. So that brings me to the next question, which is you have already briefly alluded to that. How does vaping affect our lungs, especially the growing lungs, the adolescents when the lungs are still not reached that adult stage?
Yeah, so the vape, the aerosol which is generated obviously is inhaled, and the lung is the first organ which receives that vape. Now, it has been shown that inside the airways there is increased amount of airway resistance, friability, and edema. The deposition of vape aerosols of ultrafine particles and heavy metals lead to a lot of problems. And there has been some changes in the innate immunity as well. The pro-inflammatory cytokines inside the alveolus leads to inflammation, and there is more amount of proteolysis which has been found. So basically, it is the thermal degradation product of the vape solution, which includes THC, flavorant, and diluents, which actually lead to the pro-inflammatory state. There have been a lot of work on THC related compounds and problems. So these THC related compounds can they have shown to be thickening agents, and it is possible that increased exposure to vitamin E and the compounds like this can actually lead to formation of a dysfunctional surfactant inside the lungs. And when this dysfunctional surfactant forms, it leads to excessive lipid accumulation inside the alveolar macrophages, and that is a known irritant to the lungs.
Right. Yes, this is just highlighting the same, and this is, and you discuss these patterns.
Yeah, so people have seen a lot of patterns of lung injury, and the problem is that you don't have a very specific pattern which can be related to vaping in adolescents or adults, and it actually mimics a lot of respiratory conditions. So that's a problem which people have found throughout the world. So the patterns which have been described are patterns of eosinophilic pneumonia, and I'll show you some images on them. So patterns of hypersensitivity pneumonitis, organizing pneumonias, and diffuse alveolar hemorrhage. people have shown to be presenting with increased episodes of asthma, increased episodes of pneumothorax. So a lot of conditions in pediatric pulmonology and even adult pulmonology can actually mimic vaping. So there is a definitely increasing need to be vigilant that if you have a child or an adult who presents with illnesses like these, we actually need to elicit a history of vaping. So for example, and these are not my cases, these are taken from these references as mentioned below. So an 18 years old who presents with a pattern of organizing pneumonia, who used to vape nicotine and THC, presenting with high-grade fever, vomiting, and there was no evidence of any infection or rheumatological disease. So you can see the X-ray on the left side of your screen. So hazy opacity is ground glass appearance, which is quite evident. And if you look at the right image, which is a sagittal image in the lung window, so there's a CT scan of the same child. So it shows dense ground glassing associated with septal thickening, right? And this was actually proved to be because secondary to vaping. So the next slide. Yeah, so these are other patterns which have been documented in literature. So again, on the left side of your screen, there's a 21 years old boy who had vaping associated lung injury, and it was documented to be an acute eosinophilic pneumonia, who had been vaping again nicotine and THC daily. You can see the X-rays which are there, extensive consolidations, lobular and subpleural sparing is there. And the bronchoscopy was done, which shows significant amount of eosinophils which were there in the lungs. And this is the third X-ray, the third image, or the C image, is the X-ray which was there once the child received a course of systemic corticosteroids. On the right of your screen, again, you find a 41-year-old gentleman who was found to have this vaping-associated lung injury, and it was a documented diffuse alveolar hemorrhage which was there. So the CT shows fluffy shadows which were suggestive of a pulmonary hemorrhage, which was there, and it was confirmed with bronchoalveolar lavage. And this is a classical picture of a person who presented with features suggestive of hypersensitivity pneumonitis. So they are GGO nodules or ground glass opacity nodules which are seen throughout the lungs, which are there. It was commonly, so this pattern is commonly associated with hypersensitivity pneumonitis, and the patient rapidly improved after administration of corticosteroids. So I think this is a new era which we are getting into. So more of westernization gradually, children, taking up vaping, hearing of vaping parties which are there. And over time, we all are going to see problems like these in our clinical practice. So the point is that how do you suspect that this is because of vaping? So, keep a high index of suspicion. We have to remember that if the patient has constitutional symptoms, GI symptoms, abnormal chest imaging, biomarkers which are suggesting a pro-inflammatory state, there's hypoxia which is there, and you do not have a very clear explanation, alternate explanation to symptoms, think about vaping, we have to rule out alternate differential diagnosis, because there is no one thing which can prove that this disease is secondary to vaping, right? So it still remains as a diagnosis of exclusion, and when that happens, you have to evaluate this child or the adult for rest of the viral pathogens, which might include a bronchoscopy. But if you have no other diagnosis, then think in terms of vaping. So as I said, to summarize, the lung pattern injury, it remains a diagnosis of exclusion. You need to have very high index of suspicion, especially when you are confronted with idiopathic lung injury in a patient who has been having a vaping exposure.
So, Dr. Ankit, as I understand, there is no distinctive pattern, and keeping a high index of suspicion is very important. So unless we think about it, we will not come to.
Yeah, so you're right. See, these are things which come up in the literature. These are things which were severe enough and they got published. Now, supposingly, I have a child, 16 years old child with asthma who is not getting better. Okay. And you're on highest dose of inhaled corticosteroids using so many drugs. Okay. Do we actually take a history of vaping in these children? Well, I don't think we do that, right? If you ask them, the parents may not like it, the child may not like it, the child may not actually agree to vaping. In a lot of centers across the world, as I understand, child psychologists would be a part of a severe asthma multidisciplinary team. And people would be actually looking at these factors if they are there. So I think there's much more than what we are looking at. There might be groups of patients where there's a mild lung injury, which we are still not picking up. But I think the problem is much more than what meets the eye.
Right. So, Dr. Ankit, this is all about lung injury, but does it affect other systems as well?
Well, yes, there has been a lot of work upon the cardiovascular aspects of vaping. So what people understand is that the cigarette aerosol has two types of compounds. One is nicotine and the other is the oxidizing chemicals, particulates, and the acrolein. So the nicotine actually is the leads to sympathetic nervous system activation or catecholamine release. It leads to coronary vasoconstriction. It leads to tachycardia, hypertension, increased myocardial contractility. It leads to ventricular arrhythmias. It also leads to some amount of endothelial dysfunction. Now, the oxidizing chemicals, particulates these are the pro-inflammatory substances, leads to platelet activation, thrombosis, and in addition leads to endothelial dysfunctions, reduces the myocardial blood flow, and leads to myocardial ischemia and infarct. So, and this is from the American Heart Association's statement on the cardiopulmonary effects of vaping.
Right. So just like cigarette smoking, it has a significant cardiac impact as well. So, Dr. Satinder, how serious is this problem in real world situation? As you encounter a lot of kids, I guess, with vaping. I'll first ask Dr. Ankit, what is the medical aspect of this addiction? Like, obviously, it is addictive. We have discussed this.
Yes, so nicotine basically is the substance which actually leads to a significant amount of addiction. So it is basically an activator of the sympathetic nervous system and effects on the cardiovascular system, as we talked about. It leads to endothelial dysfunction, oxidative stress. It leads to reduced impulse control, deficits in cognition, mood, and addiction. And it has been seen that the brain grows approximately till the age of 25 years and leads to formation of synapses. And when a young person starts vaping, this gets incorporated. And when that happens, it leads to a very high addiction to nicotine.
Adding to that, the nicotine actually also, when absorbed in the bloodstream, stimulates the release of dopamine, which is also a pleasure-seeking neurotransmitter. And once you get into that thing, it further creates the craving for it. And frequent cravings will lead to more vaping, and that will lead to more tolerance development, which will make it more addictive. So similar way, like the other products. So once you start nicotine addiction, you might be susceptible actually to be addictive to other substances as well. As we've talked about, that it may start from the e-vaping, and then the chemicals people might alter that and they may change. So you can also be a susceptible personality to use substance, but then once you start from here, it also leads to more substance abuse. So it is definitely addictive in nature. And as the research is showing that children and adolescents are more, and as Dr. Ankit Parakh had said, that until 25 years of age, your brain is developing. And once you start doing this addiction, your brain actually become more susceptible to further addiction rather than when people started later in their life and then they are not susceptible to that much addiction. So a lot of people think that vapor produces harmless water vapor. I have heard students saying that it's just a water vapor. There is nothing, it's just a fruity thing and it's just an enjoyment. And I think we've covered that aerosols themselves can create. It is not a harmless thing. People think this is safer than smoking, but what we are hearing that it has a similar damage and similar pattern of damage, and maybe we are not reporting because somewhere we also think it's illegal. So we are not even studying these behaviors. And since we do not take the history, and as Dr. Parakh has said that even if you will ask children, it will be very difficult for them to actually report it. For that, you need a very intensive kind of a input from the parents because or from the children, because until and unless they feel safe, because there's a discipline strategies associated with that, so it will be difficult for them to report. Vaping doesn't create secondhand smoke. I think that's also a myth. That is not true because people around you are also getting impacted in the same way as cigarettes do. It's easy to quit vaping and it's not addictive is also a myth. As we said that nicotine itself has the similar kind of effect on brain like other products do, maybe at a less level. And because once you start using it and then the tolerance develops and then you start taking it more, can lead to more and more addiction. Vaping helps people stop smoking was the idea when the vaping was initially introduced, but the research hasn't supported that. Actually, vaping has become the equal kind of a challenge like the smoking was. And in fact, the research is showing that people who started using vaping instead of cigarettes have started being addicted to both of them together. Vaping helps with stress and anxiety. Again, that's not a truth because it's a vicious circle. Whether you get stressed and anxious, then you use this as a coping mechanism. And then once you start using it, it further exacerbates the stress and anxiety. And then there is a more chances of a further use of that.
Right. So vaping versus conventional smoking, we have been discussing this all along. Dr. Ankit, anything to add?
Yeah, so I think we have
Covered this
about it. So what we understand is a few things which we understand. Well, it was thought to be, less harmful than cigarette smoking. We understand that because of the involvement of tobacco in a conventional cigarette smoke. So if you look at any of these things, then it would be it would be a higher chance of a side effect, which might be in human studies or in animal study, in vivo study, in vitro studies. So everything seems to be there for cigarette smoke. It seems to be less for a vape. We understand that. So, but it doesn't prove that vapes are harmless. That's absolutely a wrong statement. Vapes are definitely not harmless. That's one. Second part, as I said, that it's you're looking at the conventional vape, right? You're not looking at a vape which is hacked. And a lot of vaping actually now involves a hacked product, which includes drugs, right? That's a very serious issue which is coming up. And as Satinder said, you end up vaping and smoking both, right? So it's not something which is actually helping. It's not something which is if people believe that vaping is just for fun and you're not and you're quite safe, that then that's actually wrong.
If you are vaping and smoking both, you're only going to multiply the side effects. And it may appear theoretically to be less harmful, but you cover that up with more vaping and addiction level is pretty high. So it is bad only. So we'll just talk about a case scenario. You have a 15-year-old boy who is caught vaping in school. He admits to vaping for last 3 years. He's brought to hospital for review. Dr. Ankit, anything medically that we can do in this child?
If this child has been vaping for the last 3 years, then obviously you would like to examine this child. You would like to ask for symptoms of any respiratory symptoms, any chronic cough, any asthma-related symptoms. We would like to do at least two things. We would like to do a chest X-ray and a lung function to see that, whether there are any changes in the lung function or anything on the X-ray which we can find out. So that's about the medical part of it. And obviously you need to take a good history, which Satinder is the boss in that. She can bring out history which you and I cannot. So I would, hand it over to her and let her take a proper detailed history, which is very important. So I think I'll hand over to Satinder that how would you deal with this patient and what would you do?
So there is a broader aspect to it. I think there's also a question in the chat box. Dr. Vibin asked that if a child get caught, can they be punished if it is illegal? Most of the time, what I've seen is that these things don't get reported. So schools are not going to report. They will let parents know about it, but they will not get reported. But yes, if it is illegal, it can be persecuted in that manner. However, there are many factors which actually leads to children getting into this pattern of vaping. Some are doing it just occasionally, and some get forced into it, and some get addicted to it. So a child who has been vaping from last 3 years is quite a pattern. So a pattern of addiction has to be explored here, and the child might need a long-term kind of a rehabilitation, which will include the counseling and the medical interventions along with it, depending on the individual need. So a lot of work. So that comes to the treatment slide. One part of is the treatment for vaping hasn't been listed any different than what cigarette cessation has been used. So nicotine replacement therapy works from the medical perspective. A lot of counseling and behavior support. So by that, it means like open communication with the child. We need to educate our children the health risks. So I think many times we start talking about this one, the incidence has happened. So more and more educational programs for the parents, for the schools, and many schools, in fact, some schools are running programs where they are actually informing children what could be the health risks of these vaping incidents and starting drinking. So substance abuse and alcohol problem has started as early as middle school problem. Vaping also is very common from the middle school onwards. And I am saying it from the personal experience because children from 6th, 7th grade are easily, they know what vaping is. They have seen in the bathrooms. They also report that it is somewhere in the bathrooms, they go and they use it and then they move on. So I think the educational programs and parents need to, and the schools do put, although it is on the paper, putting the clear expectations and the rules and encouraging children to have a positive coping mechanisms, because many children will say they are stressed and they are having other challenges and they are coping up to this, or they are doing this just to be cool. So modeling the right behaviors. Many times the alcohol problem starts when parents are actually in Diwali parties. I've heard many schools, actually the school parties, from the 8th grade onwards, 9th grade onwards, alcohol starts getting served, which is again from the parents' side. Vaping and alcohol is allowed by the parents. And if that happens, more and more parents actually feel pressured, or the children get exposure to the substances from these parties itself. Monitoring and discussing and staying involved in your child's life is something which we kind of continue to do that. So counseling, individual counseling only happens when the child has been caught, or we are very sure that the child has been indulgent. But a lot of work can be done before children actually get indulgent into these substances.
Right. So we had another scenario where a 19-year-old boy admits to smoking for last 5 years and he wants to explore vaping. And I will answer this that as we have totally understood in last half an hour that vaping is as bad. So moving on from one thing to the other won't help. And he will end up doing both and multiplying the damage. So vaping is as bad as smoking and can even be more harmful because of the potential of the various chemicals that can get into vape, which may not come from conventional nicotine. And it does not help in quitting cigarette smoking. That's as simple as that. So just from my side, vaping is a widespread problem, already is there in adolescents and young adults. It is not safe. It is as addictive as smoking. And I think educational programs in schools and real effort both at the level of school and the family to show the right behavior, not just say it, to show the right behavior, and hopefully the kids will follow what they see. And the legal response also has to be more rational. A simple ban or a simple stating that it is illegal, and so everybody just goes on, does not help. So probably some effort also needs to be worked up there. Any closing thoughts, Dr. Ankit and Dr. Satinder?
Yeah, I think though, so as respiratory physicians, we are still not, into that mode that we are looking at vaping-induced lung injury, and possibly we are also learning as the time passes. And obviously, as Satinder said, that it is a problem which starts at middle school. So you are looking at a child, middle school means you're looking at a child like 11, 12 years of age. So starting at that age is actually too early. So we need to keep our eyes open if you have a child presenting with any of these respiratory problems or common respiratory problems who are not settling down. So we need to keep our eyes open. Um, and I think we all should be proactive and should be doing some educational programs, because I think it is only the education which can, help some people to not go on to vape, or discourage some people to stop vaping. As everyone understands, it may not be just the legal compulsion which is possible. If that was possible, then the cigarette industry would have been stopped, which has never happened. So I think we have a role to play in educating children early, that this is something which can be very harmful.
Ma'am, your thoughts?
Similar, I think Dr. Parakh summarized it very well. Most of the time, especially in our country, we actually work later as a retrospective, or we treat the symptoms. But these are the things which can only be curbed by having more and more awareness. And I think as a parents, or as a pediatricians, we can tell parents to start talking about substances or vaping from a very early age. Like we talk about the child abuse, I think similar manner we need to start making them aware that these will be things offered to you, rather than talking to later. Because I had a ninth grader recently, and he went to a party and he had a drink, and the parents got really alarmed with that. And this is what I told the parent, that if a child at this age, the kind of school he's going, this is very likelihood going to happen. So we need to start having these conversations from a very early age, rather than waiting an incident to happen and then we are going to talk. So I think preemptive and proactive approach is something which is going to work, rather than treating the symptoms only.
Absolutely. Sensitizing the children is critical before they get into this.
Yeah.
Because once they get into this, things get more complicated.
Yeah.
So at least when they are getting into it, they are aware of the risks. And hopefully they will get the sense to not go for it or be careful.
Absolutely.
Right. So any queries? Dr. Ritika will take over from here. And
thank you so much, Raman sir, and thank you so much to our panelists, Dr. Ankit and Dr. Walia. This was a really great, very informative discussion on a very upcoming problem. We are seeing a lot of adolescent kids moving around with a vape, and the vape looks just like a simple pen drive, or it looks like a toy. So it's a big hazard, and I think as pediatricians and as young parents as well, we all should be aware, so that we can prevent our kids from getting into this habit. On behalf of IAP Central Delhi and BLK-Max Center for Child Health, I thank all the delegates, all the participants today to take out the time and get involved in the discussion. Do we have any questions? Okay, so first question is, as this is a banned item, is a child legally punishable under any BNS Act if caught vaping? So I think we've already covered this point. Then next question is incidence and in which age group it is being used more frequently. Satinder ma'am, would you want to answer this question?
I think I already answered. As soon as middle schooler from 12 to 13 years, it's very prominent now. You can see sixth graders are aware, they have seen vapes, and it is something which is from that age onwards. By middle school, children are actually started to use it more often. So middle school, they start getting hand of it.
All right. Ma'am, are you seeing, I'm sure you must be getting a lot of cigarette smokers also, adolescent cigarette smokers also. Do you feel that since the time vaping has come up, cigarette smokers have gone down, or children are doing both the things together? Like, what is the prevalence of the habit forming activity going on right now?
Actually, cigarette smoking never came down to that age. It was little higher, high school or college students would indulge more. But vaping, you are seeing it much earlier because of the easy accessible and the myths people have that it is safer. And you can talk to any middle schooler. I have a middle schooler, and I have talked to his peer group, and they all have this thing that it is very safe. It is not something which harm you, and this is something embedded in them among with each other. So that is something which is commonly seen these days.
And I think in addition, see, you can't smoke inside a school, right? That's not very easy because a lot of school now have guards employed here and there, and they're quite strict. They will
And
catch
fire detectors.
Okay. There's an aerosol which is formed, which you can recognize if someone is smoking inside a washroom. There's smoke which is produced. There's a stench which is there, and then if someone is smoking, then there is ash and there is a bud which is left. Now that's difficult. So people would be smoking, on a panwala or something outside the school. The good or the bad thing about the vape is that as we already talked about, it comes up in so many variation. If you have, it looks like a pen drive. It does not leave that stench. It does not leave that odor. So it's very difficult to control that even inside the school. If someone comes with a vape inside the bag, it's very difficult to pick up a vape, and it's easy to vape anywhere in the school and not get caught.
And actually, school students are vaping and they get caught in the school only mostly. That does happen. I think there's one more question, that are we legally bound to report to police? That I don't think so. Schools ever report it. From the pediatrician perspective, I am not aware of that. Dr. Parakh, do you have any idea?
I don't think so. And I don't think so that.
नहीं वो बंदेज के बनते ही नहीं ना, वो दिक्कत यही है.
If you, I don't think so. It's going to be as easy. If you report it, then how will the you actually tend to lose any contact with the family. The parents may not like it. So I think.
Okay, so there is cigarette smoking as well, and this is illegal. Cigarette smoking is also illegal at that age. And when you report it to the police person, he also does not know what to do with it, because they are not actually implementing the act, the law which is there since 2019. So it is a complicated situation. It is not a straightforward situation.
So reporting it to the police is not a solution to the problem. The panwala is selling ganja. So I think the problem is much more widespread, and it requires, if you want to curb them, if you curb drugs and all these things, then it has to.
That is not going to lead to any solution.
Yes.
See, just reporting it to police is only going to complicate it, and
Absolutely.
he will not know what to do with it, but he will settle it in the other way. But the real problem will remain. So reporting to police, I don't think so. It is not going to cause a serious self-harm. See, a suicide is there, or suicidal tendency or something which is imminent threat to life. It is not an imminent threat to life. So I don't think so that there is something like that is important. It is more important to take it in a more community way where we want to lead to the right path of trying to help the child.
So
I think
well-being of the child
Is
and the
critical.
family should be the priority. So maybe reporting to the police may add to more challenges and more problems.
So thank you everyone. Thank you, Raman sir, and thank you, Dr. Ankit and Dr. Walia. And we'll see you for another interesting discussion after 2 weeks in another session of BLK TELE-PEDS. With this, signing off today, I'm Dr. Ritika Goel. See you all.
Okay, thank you.
Thank you. Bye-bye.